Good morning, ma'am. Can I come in?
Yes.
Ma'am, I wanted to interview. I had some questions in my mind.
Okay.
So, can I ask you some questions?
Definitely. Yes. Go ahead.
So, ma'am, it's personal. आप कुछ भी इसमें जैसा भी आपको लगे, you can answer in any way possible. So, when you were MBBS student, did you ever imagine yourself in community medicine?
To be honest, yes. Ever since I entered MBBS, the only subject which I liked was community medicine. So I had imagined myself to be either teaching or learning community medicine only, nothing else. But if you ask me, at our times when we were doing MBBS, we were not so focused on getting MD and all. MBBS was our immediate target. So we never really thought of MD community medicine per se. But then, yeah, community medicine was my favorite subject. I actually didn't like most of the other subjects.
And was community medicine was your first choice or the decision that grew on your in your mind over the period of time?
Definitely, community medicine was my first choice. As I told you, I liked only that subject. That was probably because I grew up in a public health environment. My father was a doctor who was in government service in Kerala. So I grew up in a PHC.
Oh.
I have seen everything written in Park right from childhood. So it was not like I was reading something theoretical. Whatever I saw in my childhood, I was reading.
Okay.
Technically. So I could relate so well to it, and I generally like social studies and everything. So it was something which I've always liked.
Okay. And what was the defining moment that made you feel that this field truly matters for you?
Maybe
That one turning point.
my selection to CMC Vellore, Christian Medical College Vellore, to do MD Community Medicine was definitely a turning point in my life. Whatever I could achieve or whatever good things have come to me are through CMC Vellore, my training there, the wonderful set of human beings, not only my colleagues, but also the wonderful community which we worked with in Vellore. So I owe everything to Vellore, I should say.
Okay. So why is community medicine often labeled as non-clinical branch? Do you think that perception is justified?
Uh, Non-clinical, maybe that perception came in because right now, if you see, only few institutes are doing community medicine differently, including CMC Vellore, like maybe AIMS, St. John's, Wardha, MJMS Wardha. These are the few institutes who actually uh, do the community medicine training little differently from all the other colleges. I mean, there are reasons for that. Systems are quite different in these institutes and the other majority institutes. The support you require to do core community work is immense, and it may not be possible in many settings.
Okay.
So yeah, in owing to the nature of work in other places, they may be branded as non-clinical, but I don't agree in that clinical non-clinical debate also. Okay. Because being in the clinic and outside, both are important.
Yes.
So
And at the
even if you call it non-clinical, it's fine.
Yes,
That's
ma'am.
okay. Don't see it as a degrading word. It's fine.
And at the end, we all are seeing the patients only in
Yes.
any way, whichever is
Patients
possible.
community, as far as our specialty is concerned, wellness is more important, prevention is more important, community is the most important. So I don't engage myself in that debate.
Okay. And what aspect of community medicine do students? I'm sure you must have taught many students आपके अभी तक. So do students mostly commonly underestimate this subject? Do you think so?
Yes, of course. Students do underestimate the subject, but that is also because it is mishandled in our teaching institutions.
Okay.
We don't know how to train children in community medicine, introduce them to the right spirit of community medicine, owing to various limitations.
Okay.
But many a times I've also seen that we're not trying to overcome those limitations also. But my hope is in the coming generation, or like you can say even my contemporaries, many of them are doing very good work, going outside many of these premier institutes, and disseminating the same culture and trying to bring in that kind of core community work.
Okay.
So if children get to know that, things will be different.
How would you respond to someone who says that there is no patient interaction in community medicine? Do you think, is it justified or is it wrong to say that?
Patient interaction, you see, when you do your community work, you're essentially seeing all your community members, and you can do health checkup for them. You're doing that as part of your many activities, and you're not seeing patients. Who's preventing you from seeing patients? But yes, I do understand that from certain departments, it's totally within the classroom. Okay. And there are no preventive clinics in many of the places. But preventive clinics are part of our specialty. And as far as my training was concerned, we used to run a secondary hospital. It was 120 bedded.
Okay.
Only community medicine PGs and community medicine consultants used to run that hospital. We used to do close to 300 deliveries every month.
Okay.
We used to see patients daily. Casualty patients were some 80 to 100, and we used to have OPD close to 300, 400 every day.
Oh.
So it was such a huge center in the sense, not in terms of size, but the population it catered to, it covered 80 villages of the Kaniyambadi block.
Okay.
So people were coming from the entire block to that particular hospital, CMC. Our department's hospital was called Community Health and Development, CHAD.
Okay.
We also did community work. So it depends upon which institution you are in and what kind of training is happening there, that the amount of patient interaction that is happening. So it is wrong to generalize and say that community medicine does not have patient interaction.
Okay, ma'am. So now I would ask, there are many people who are seeing this video for their future prospects कि उनको community medicine लेना है, but they are confused what is career opportunities after that. So what realistic career pathways you think are available after MD community medicine today?
So after MD community medicine, in whichever institute you are doing, the default option which is open to everyone is that of teaching, and many people still think that is the only option. Okay. Teaching, where you go into a medical college and you follow the career path of a medical teacher. Yes, that is number one. Second thing is, you can work as a researcher, a core researcher, where you will engage in various basic science, biomedical, implementation research, health policy and systems research, whatever projects they are, and you work as a scientific person. You work as a public health scientist. Okay. So in that case, you will be attached to some research organizations or some research institutes, or maybe even as research organization within medical colleges also. Okay. Some medical colleges do have a school for research, something like that. Yes. That is one option. Another thing is get into public health programs, where you will be the implementing person of public health programs. Because as you know, many national health programs run with the support of various donor projects also. Okay. Like funded by WHO, not by WHO, but funded by USAID. USAID is no longer there. Okay. But Tata Trust, Japaigo, there are multiple donor projects running in various health programs. Yes. So you could be an implementing person in that. or you could also get into government healthcare service, where you will be serving the dual role of clinician, being a clinician, running a PHC, as well as preventive work you have to do. Typically, whatever you learn in community medicine textbook, that is what is practiced in a PHC.
Okay.
Ideally, because you're supposed to take care of a small primary health center, you are in charge of that. Plus, you have to do community work.
Okay.
Yeah. So these are broadly the options. Of course, there are multiple other things also coming up. But health policy, another thing is health policy. You can work in with Ministry of Health, or state, or central government, where you will be a consultant giving technical advice. That is also one thing.
Okay. So I think there are many opportunities which are not known about to the people. Okay. So how do you think over the period of 10 to 15 years this branch, community medicine, has evolved?
Definitely. And community medicine, or public health, is one branch which rapidly keeps evolving. But only thing is, many people are not aware of it.
Yes, I agree.
I think even the general public, or the just people just outside, or I can even say people within medicine itself, knew about the importance of community medicine only during COVID time.
Yes.
Where public health personnel were involved hugely.
Okay.
So that kind of lack of awareness persists among medical fraternity itself. Maybe they have seen people who are not interested in doing actual work. That might be the reason why they have a perception like that. But that's not the case actually. The branch has a lot of potential.
Okay. So do you believe community medicine is more relevant now than ever before? If yes, then why?
Definitely, it is very, very relevant, because the body of knowledge is developing, right?
Yes.
We have more knowledge about the pathogenesis mechanisms. We have more complex health system. When you say health system, it includes the community, the providers, the goods, the financing part, everything together. If you refer to the WHO health systems framework, that block, everything together is called the health system. It is becoming more and more complex. We have more humanitarian crisis right now. Everything makes public health more relevant, and we should focus more on prevention. That is definitely important. And I think the body of knowledge, with development of body of knowledge, definitely the scope also increases.
Okay. And I think after COVID, prevention has gained more importance than curing the disease. Okay. So what type of student is best suited for to choose community medicine? Do you think there is any specific pack of students who are best for it?
One should be very patient if you're choosing community medicine. I personally believe that, because a public health intervention, so community medicine, you can say, is the theoretical part of public health, and what you practice is your community health or public health. So you have to be very, very patient in receiving the results of your interventions. A public health person will not, or may not even live to see the results of the work they do. You have to be that patient. You have to be selfless.
Okay.
Whatever you do may reap result maybe after few generations. So it is very different from a clinical specialty where you get instant gratification, or the patient would be thankful to you, they will be respectful of you, or you see the change of your treatment which you administered in the patient. It's almost instant gratification or result which you get, whereas public health interventions are not like that. Public health is slow. You have to be selfless. Only then you have to take community medicine or get into public health, because these qualities are important. Don't equate it to the results which you get in a clinical specialty. Ours is quite different. And you need the work which you do, the quality of the work which you do matters here. And if you think back, many of the benefits which we are having right now is because few generations before us people did good work.
Okay.
That applies to most of the cases, but
Yes,
in
ma'am.
public health it matters the most.
Okay. So it takes time.
Yes.
You have to give it time to.
Yes, definitely.
Okay. So who should probably not choose this specialty? Is there anyone, or you think everyone is okay to choose?
See, actually, ideally speaking, every other specialty will have a community component to their specialty. It is there, right? But very few recognize it. If you take ophthalmology, there is a part of community ophthalmology.
Yes.
When you are seeing a patient in a medicine OPD, you cannot dissociate that person from his or her social settings, or the background from which they come from. You need to consider that as well. So every practicing specialty also will have a community component to it, because we are all dealing with humans. That human component is there, but very few people recognize it.
Okay.
And who should not take this? That coming to that, as I told you, if you are expecting instant gratification, don't take this. If you do not like to wait, or if you do not like to liaise with people, you'll have to deal with a lot of people.
Okay.
In an OPD setting, in a clinical setting, that dealing is quite different. A patient comes to you, you are the doctor, you are on a pedestal, or somehow we place ourselves on a pedestal. Whereas it is the reverse in community medicine. You have to get into the community, you have to be one among them. You
Okay.
have to shed all your ego. Then only you will
Flourish.
or like you can do well in
Yes.
community medicine.
Okay.
So only if you have that mentality, take it. Otherwise, don't.
Okay. And what is one common mistakes which students make after entering community medicine as a branch?
Common mistakes,
Or
as
you have done, if any,
uh,
like any common mistakes?
yeah, I used to get very much overwhelmed by the statistics part, because I'm not a person who's very good in numbers.
Okay.
But I realized that it is just part of it.
Yes.
A lot more things are beyond that. So initial impression for us, maybe even during UG days, oh, it has got a lot of statistics. But statistics is a fun subject if you deal it in the right way. Biostatistics.
Yes.
It's not pure statistics that we are dealing. It's biostatistics. And biostatistics is best taught by community medicine people, like that, because pure statisticians, they are very technical, their brain is wired that way, right? So
Yes.
they may tend to take it more technical, but biostatistics, if you have to teach, a well-trained community medicine person can teach it the best, I believe so.
Okay. And I think as a medico, we are scared of mathematics in
Yes.
general. So that fear is there already. So, okay. Now the fun part has started. So some fiery questions I will ask. I'll give you two options. You have to choose one.
Okay.
And if you want to explain why you chose that, that's your choice.
Okay.
So, okay. Fieldwork or classroom teaching? What you use? District posting or academic institute?
District posting.
Okay. Research or administration?
I like both.
Okay.
So, but maybe.
But I have to choose. You have to choose one.
Maybe research little bit more.
Okay.
Yeah.
One word to describe community medicine, according to you.
Patience.
Okay. One book.
As in PATIENCE. Not
Okay.
the ill patience, not
Yes.
them. Patience. Wait.
Okay, ma'am.
Wait.
One book every community medicine resident should read.
Well,
Curriculum wise or other way?
other way.
Any
Okay.
both.
Both way. I feel Leon Goddess is a wonderful book.
Okay.
Leon Goddess Epidemiology.
Okay,
Each time you read that, you get a new perspective of epidemiology. Other than that, I don't know, like it also depends upon niche areas which you try to develop yourselves on. So, in general, as a community medicine resident, if you say, like, I would suggest Leon Goddess as a textbook, and but otherwise, you should read about Dr. Paul Farmer. Dr. Paul Farmer is that one person whom every public health person should be emulating.
Okay.
So, Dr. Paul Farmer's books are must read. The earlier you begin, better.
Okay, so that book matlab enriches you as a
He
public
has
health
written many
personnel.
books.
Okay.
So
Okay.
his work in the remotest parts of the world. That is what and
Okay.
the learnings from that. He's no more, but we should read Dr. Paul.
Okay, ma'am. So last few questions. One myth about community medicine you would like to bust?
One myth about community medicine, that we are jobless.
Okay.
Many people do think that we are jobless,
Okay.
but as I told in
Yes.
previous questions, it's
There
just
are
because
prospects.
people mishandle it or people don't know how to deal with it.
People don't have awareness about this
Yes,
subject.
yes.
If you were a resident again, what would you do differently?
I definitely would have been more mild talking to my patients, because
Okay.
we were sleep deprived, tired, and
Yes.
everything when we were
Okay.
dealing with patients during
Residency.
residency time. The 3 years intense training in CMC, we never used to sleep. But like, it's not like we did some cruelty to them or anything, but it was fun kind of day. Also knew we are not like angry at them, but it was a fun altercation only.
Okay.
But I think I should have little bit more
Calm.
mellowed, calm,
Okay.
more calm. At least I wouldn't have had to take so much stress. But it was good. Those people were wonderful. They gave us all the liberty to, be one among them.
Okay.
Yeah.
Describe community medicine in one sentence, if you were to.
One sentence. Community medicine is a specialty which you can take only if you are selfless.
Okay. Oh, anything, any last words you want to give before I end this video? To
Community
anyone, like any person who wants to take community medicine, or anyone who is non-medico, is unaware about this subject, what it is, anything.
So public health is not something which is learned from textbook alone, or community medicine, you can say. I see the practicing version of community medicine as public health. So it is not something to be read from textbook alone. You learn it from community. If I borrow my mentor, Dr. Rakesh's words, it is the most empowering and most powerful when you learn it from the community itself.
Okay.
So I also believe that.
Okay. So it was a great learning from you, ma'am.
Thank you.
Thank you so much for the interview.
I also had fun talking to you, Aditya.
Thank you, ma'am.